NG Cares Nigerian COVID-19 Action Recovery and Economic Stimulus Local Jakage State Community and Social Development Project has collaborated with Dual Care and HIV Prevention Initiative to offer more assistance to the vulnerable groups and needy in education, health, infrastructure, nutrition, and water supply. The Chief Executive Officer of Dual Care, Roslyn Omowumi Alabi, noted that the main intervention needed for vulnerable groups under DCI is malnutrition and health challenges. Our reporter has more. Caring for others is a great expression of humanity, as it is the bridge that connects us to one another. NG Cares Nigerian COVID-19 Action Recovery and Economic Stimulus Lokaja has agreed to work with Dual Care and HIV Prevention Initiative in making provision in line with the organization area of intervention programs.
I would like to know, possibly maybe to simplify it more, what support are you expecting from the agency? Yes. So that will guide us in our approach to this process.
The Monitoring and Evaluation Manager of Community and Social Development Agencies Lokaja, Ayo No Parking, said after the expression of interest received from DCI requesting support for people living with HIV/AIDS, the organization have initiated the process to provide support through participatory rural appraiser with DCI.
We received an expression of interest. We align it to intervention sector that the office can provide for them. So at the end of today's activity, the group will have identified at least 3 intervention support areas, minimum of 2, maximum of 3, 4. Then they will be able to also elect group project management committee that will manage the implementation of the support that will come from the office.
CEO of Dual Care Roslyn Alabi and Moses Adamu, the peer educator of DCI, spoke on the area of identification of intervention support and the needs, which will be aligned with the intervention sector for provision of the needs identified for the vulnerables in this.
Today, first, Kogi State Development Agency, they have came to look to assess us whether what we wrote in the expression of interest is reality, and they also have come to follow the due process so that at the end we can be at the same page. And the issue of minority children is so rampant in Kogi State, especially with we have special groups here and children living with HIV. So their problem really is health and nutrition. So we are here to interface with them on what we are supposed to do. And also they have come to educate us on their different thematic areas.
So we're calling on the infrastructural support. Since the infrastructural support is not just building alone, if it's a hospital or a clinic we choose now, they've even told that they're going to provide the drugs. It's a sort of empowerment.
Project Officer in charge of Community and Social Development Agency Lokoja, Sam Opanachi, said NG Care has come to accredit DCI and check for their eligibility to benefit from their NG Care's intervention.
Expression of interest have been approved by the management of Kogi State Community and Social Development Agency Lokoja. That's why we are here today. After today's engagement with this group, we are going to come up with some things. Number one, the likely projects that are supposed to meet their needs. They are GPMC, which is a Group Project Management Committee. Those ones are necessary things that must happen to them. The needs are going to be prioritized to tell us if they have 4 needs. We're going to make sure that we have the top as the first priority, second priority, third, and fourth. So these are the things necessary for further approvals. this things must meet what are eligible for funding in their identity.
Roslyn urged all caregivers in DCI not to be discouraged and appealed to all well-to-do people to come to the aid of the vulnerable and support them as many are in need of social amenity.
I want to even thank the Almighty God for what is happening now in Kogi State, and it is as a result of the scope of advocacies and awareness creation. We are flagging off our nutritional support because we went to Kogi State House of Assembly and the honourable members jointly supported us financially and materially. I want to thank members House of Assembly. They have done well, and this is the first of its kind, helping the vulnerable children, helping the vulnerable women, helping everybody one-on-one. In fact, it is a plus to them. God will bless them and God will take care of their children too, wherever they are. And also our Billy, Honorable Billy, is the one, she gave us an office free of charge that we should use it until we are able to get a good place. So she has done marvelously well.
The participatory rural appraiser ends with DCI group heads and members voting the areas at which they want the energy cares to intervene. I am Abiodun Sadiq, reporting for MLC TV.